to Drug Talk. I'm your host, Garrett Campbell. Today on Drug Talk, we're going to be talking about a medication known as acetaminophen. In the previous two episodes, we discussed ibuprofen and pantoprazole. In this episode, I'll try to make a few distinguishing differences between ibuprofen and acetaminophen. So first, a quick history lesson on acetaminophen. It first came about in 1886, when two scientists by the last names Kahn and Hepp published a paper talking about a medication with the brand name of antifebrin. The generic name for this medication was acetaminophen. It was first seen in America under the brand name novo-gesic, which contained acetaminophen, caffeine, and aspirin. That brand was pulled off the market a year later due to some safety concerns, but in 1953, Sterling and Winthrop Co. brought it back to the market. Since back in the 1950s, as you're well aware, acetaminophen has become very popular. Its two main uses are to reduce pain and to reduce fever, and it's classified as a non-opioid analgesic medication. It's marketed under many different brand names, with the most common one coming to mind being Tylenol. It's also available as many different dosage forms. We usually think of tablet or liquid with acetaminophen, but it's also in many different combination products. Notably, it's paired up with many narcotic pain medications to provide additional pain when people are experiencing breakthrough pain from their single medication. When Tylenol is used over the counter, that is, without a prescription, people tend to use it for pain management associated with pains, strains, headaches, sometimes to help with flu symptoms, and some people use it for more traumatic injuries. I tend to see it used a lot in patients who suffer from arthritis. Luckily for them, there's different forms of tablets that they can receive where they can take it less frequently, and the tablet releases the medication slowly throughout the day. Because acetaminophen is so readily available over the counter, it's important to note that if you're using this medication yourself and you meet with your healthcare provider, be sure to let them know that you're using it. This way, your healthcare professional can make better decisions when they're prescribing to you, and if they feel that you're using it very frequently, they may give you something that's less hard on your body long term. Now that we're ready to dive deeper into the medication itself, this would be an appropriate time for me to remind you that this channel is for information purposes only, and if you have any questions about your care, to consult your personal healthcare provider. If someone was considering to use acetaminophen, 4 things that they should consider before they actually purchase the medication would be their liver function, their kidney function, their level of alcohol consumption, as well as their age. If you have liver or kidney impairment, it's very important to sit down with your healthcare provider, be it your physician, and discuss what dosing you can use of acetaminophen. They may not want you to use this medication. If you consume above average levels of alcohol, this could be harder on your liver than just using Tylenol alone. And in some individuals, as they age, liver and kidney function begins to decline. That's why it's important to be checked out. It's available in many different strength tablets. Commonly, we see 325 mg and 500 mg. When people use an extended release version, typically seen in arthritis, they use a 650 mg tablet. The usual dose is anywhere between 325 mg to 1000 mg, taken 3 to 4 times a day, always trying to keep the total daily dose less than 4,000 mg. Usually, acetaminophen is dosed as needed, so unless your pharmacist or physician instructs you otherwise, just take it as you need it to give your pain comfort. It's important to note that acetaminophen should not be used for pain over the counter for greater than 5 days without consulting your healthcare provider. If you're using it for fever for greater than 3 days, you should see somebody at that point in time as well. If you and your physician decide that it's appropriate for you to use acetaminophen long term, it's important to keep all of your appointments and checkups. Your physician may want to do some blood tests to make sure that your liver and kidney function stays where it should be to continue using this medication. When acetaminophen is taken, it's absorbed rapidly and almost completely by passive transport in the small intestine. It reaches its peak concentration anywhere from 25 minutes to 60 minutes. It can be taken without respect to food, although fatty foods may delay the time it takes to absorb the medication. Regardless, all of the medication should still be absorbed. If you don't like swallowing tablets and you don't have the suspension available, you can actually crush the tablet, unless it's an extended release version, as mentioned earlier, usually seen in osteoarthritis. A key difference between acetaminophen and ibuprofen is that acetaminophen has no action on inflammation. Also, acetaminophen is easier on your stomach. So personally, if I was to suffer from something like a sports injury, I would use ibuprofen because usually there would be some inflammation associated with my injury. But each individual may have personal circumstances which limits the amount of ibuprofen or acetaminophen they can use, so all of these decisions have to be made on an individual basis. While using the medication regularly, about 6% of people notice a little bit of dizziness, 9% experience a sensation of drowsiness, and about 5% of people experience a headache. Now, moving from your central nervous system to your gastrointestinal tract, about 2% of people experience diarrhea, while 1% experience stomach upset. In 3% of individuals, this stomach upset leads to nausea. Now, if you were using one of those combination products that we mentioned earlier, as an example, maybe Percocet, which contains oxycodone and acetaminophen, or Tylenol 3s, which contain acetaminophen, caffeine, and codeine, the side effects would be more severe. We'll touch on the side effects for those specific medications in future episodes. For now, the main thing to remember is, if you're using a combination product containing acetaminophen, be extra careful not to go over the maximum dose of 4,000 milligrams a day. Some people forget that those medications contain acetaminophen and then end up using it on its own in addition to the combo product. And since there have been hospitalizations due to overdose leading to toxicity of acetaminophen, it's important to always be aware of what you're putting in your body. As with all medication, there's a chance you could be allergic to acetaminophen. This would present as difficulty breathing or hives in most cases, in which case you would want to seek medical attention. Remember, there's other things you can do besides using medication to treat your pain. Tylenol works best when it's used as an adjunct therapy to rest, physical therapy, and other methods of pain management. Acetaminophen is metabolized in the liver via 3 specific pathways: conjugation with glucuronide, conjugation with sulfate, and oxidation via the mixed cytochrome P450 system. Of these 3, glucuronidation takes care of the main percentage of acetaminophen at about 47 to 62%. Sulfation can account for up to 36%. That's all we're going to discuss here today on Drug Talk with acetaminophen. As always, you can subscribe to the channel to receive notifications of when my videos are posted. I try to post one about every second day. And if it's your first time stopping by, I just really want to say thank you, and I appreciate your support. And we'll see you guys next time for episode 4. Subscribe below. And if you're interested in finding me anywhere else on social media, you can find me on Twitter at TalkAboutDrugs, Instagram at GSauce. As well, you can find me on Facebook at my name, Garrett Campbell.